Dr. Aditi Sriram is a project officer at the New South Wales National Parks and Wildlife Service. She draws from her training and experience as a wildlife veterinarian in her current role, where she works closely with the New South Wales wildlife rehabilitation sector, implementing the Koala strategy and New South Wales wildlife rehabilitation sector strategy. Prior to working with New South Wales National Parks and Wildlife Service, Aditi undertook postgraduate training in avian zoo and wild animal health through a residency program at Massey University in New Zealand, and in the same period completed a Master of Veterinary Science in Wildlife Health. In 2016, she achieved membership via examination to the Australian New Zealand College of Veterinary Scientists in the field of avian health.
Thank you. Thank you. Good afternoon, everyone, and thank you for the AWRC for the opportunity to speak today and for the intro, Dean. I'm Aditi, as you said. I'm a lowly public servant nowadays and a member of the dark side, as Simone said. And I'm here today. Well, some of you might have been at the last, a few AWRCs ago, where Peter Stathis presented some of the work that built towards the development of the New South Wales Volunteer Wildlife Rehabilitation Sector Strategy. It's a bit of a mouthful, we'll just call it the strategy. And my talk today will be an update of sorts on the implementation of that strategy. We're now 3 years in towards the tail end of the strategy, and we wanted to share some of the achievements, the learnings and future challenges for both government and the wildlife rehabilitation sector in New South Wales. So the story begins in 2014 when an independent panel of experts undertook a review of biodiversity legislation in New South Wales. The panel identified that wildlife rehabilitation is an invaluable service that should continue to be regulated, supported and better appreciated. And a key recommendation by the panel was for government to facilitate a more effective model of wildlife care, and to do this through strategic partnerships with fauna rehabilitation providers. In response to these recommendations, in 2016, National Parks initiated a review of rehabilitation services across the state. We surveyed the rehab sector and the veterinary sectors to better understand the work they do, the challenges they face, and how best to implement reforms that can achieve better outcomes both for native wildlife and for the people undertaking this work. So the Department, National Parks, we regulate the rehabilitation sector and we license 4 models of operation in New South Wales. So majority are what we call home-based groups. So these are volunteer members who belong to a rehabilitation organisation and care for wildlife in their homes. The smallest groups can be less than 50 people, and the largest, being Wires, is more than half the sector with more than 4,000 members. There's a handful of central facilities. So these are predominantly single species focused or focused on similar species, and they operate out of a single location. So where members travel to the facility to undertake their rehabilitation work. This also includes zoos, wildlife hospitals, which are also licensed to undertake wildlife rehabilitation. And then we have also a handful of independent wildlife rehabilitators across the state. The New South Wales Wildlife Council is a peak body for wildlife rehabilitation in New South Wales, and they advocate for their members, they disseminate information, and importantly, they provide a really good access point, a single point of access for us in government and for NGOs to access policy advice from a single point of contact. In New South Wales, currently there's more than 8,000 volunteers that support or are otherwise directly engaged in rescue and rehabilitation of wildlife. Meredith presented earlier this morning that there's actually a decrease in volunteer numbers across Australia, according to the ABS, but it looks like in New South Wales, the rehabilitators are bucking that trend, because over the last 6 years, we've had an increase in number of volunteers working on wildlife rehabilitation. So as part of that review, we surveyed the sector, and this was a few years ago now, and at the time we had 17% of the sector respond, which was 970 respondents. And it found that, which I guess is not a surprise to any of you, it found an older cohort of people generally engaged in wildlife rehabilitation. So majority of the people were over 51 years of age, and importantly, only 11% were under the age of 30. The sector is predominantly female, again bucks the trend when compared to volunteering across Australia, where the ratio tends to be more balanced. And although 64% of the respondents of the survey agreed that volunteering in wildlife rehabilitation had a somewhat to very positive effect on their mental health, and 54% said the same about their physical health, there was a large proportion, 17%, who indicated it had a somewhat to very negative effect on both their mental and physical health. Again, this is significant when we compare it to volunteers across Australia, where 96% of them said volunteering made them happy. So during consultations, we identified politics, conflict, lack of funding and resources, and dealing with animals in distress to be key contributors to burnout and stress in the sector. The survey highlighted challenges around ongoing capacity, pathways for engagement, future leadership, and cohesion of the sector. So what do they do? On average, in New South Wales, the rehabilitation sector reports more than 110,000 animals rescued each year. That's pretty big, and that involves more than 450 different species. Approximately 25% of these rescued animals are released, and volunteers receive more than 200,000 calls in their helpline from the community each year. These are mostly related to rescue, but they also deal with calls for requests for advice about wildlife mitigation, unusual sightings, and general information. So highlighting that they play a bigger role in community, not just rescuing and rehabilitating wildlife, but providing community advice in emergency response, as we've heard through some talks, and helping problem solve wildlife damage issues. When you compare that to our environment line that the department runs, we receive only about 100,000 calls a year. We asked volunteers about the time and financial resources they contribute to wildlife rehabilitation, and based on their responses, we were able to estimate that the annual contribution of volunteers in the sector was estimated to be around $27 million. So it's clear that wildlife rehabilitation provides significant public good. It's of high value to the environment, the community, and the government in terms of avoided costs, and importantly, it benefits wildlife. So the extensive review delivered a wildlife rehabilitation strategy with key recommendations designed to strengthen the capacity of wildlife rehabilitation. The strategy is the first of its kind in Australia and forms the evidence base informing that sort of strategic support that government could provide to the sector. It's a 3-year plan with a diverse range of actions consolidated under 5 focus areas that you can see on the left there. And it was based on extensive consultation with volunteers, their member organisations, veterinary staff, veterinary professionals, and a review of services across the sector. The strategy also incorporates actions from the koala strategy, another strategy, which was first released in 2020 and is ongoing. And the koala strategy recognises the role of wildlife rehabilitation in securing koalas in the wild, and as a result has some actions targeting that sector. I'll talk a little bit more about these focus areas in both strategies and the actions and achievements under each focus area. So for many years, the sector has been viewed as a quiet, small cottage industry with rehabilitators investing huge amounts of personal time and money into rehabilitating wildlife. The smaller groups in particular have little time and resources for the governance and more strategic aspects of their work. So actions in the volunteer support and culture theme focus on ensuring the sector has a positive culture and that volunteers are supported to meet the demands of wildlife care. So we've developed and provided a range of governance resources, including online training and workshops to increase the capacity of groups to manage their volunteers. Over the last 2 years, we've delivered more than 16 workshops, and they've been well attended by the sector. And these workshops, the topics range from things like succession planning, conflict management, constitution training, training in privacy and data management, and also social media training, which was topical in our discussion just earlier with, about vets. So good governance enables organisations to function effectively and will ensure that the rehab sector is stable with higher volumes of higher volunteer retention and ensuring continuity of service. Conflict is a recurring issue in the sector, and volunteers reported it to be a key contributor to stress. Just from one day of being at this conference, I think I've had multiple discussions with lots of people about conflict in the sector and politics and how we go about resolving that. And the same answers we found the same answers when we surveyed the sector. So only 25% of the sector, less than 25%, thought that their organisations were able to deal with conflict and disciplinary matters very or extremely well. Conflict within groups can lead to loss of members, as I'm sure you're all aware, which can compromise the viability of a group as a whole and then impact service delivery. So we engaged Justice Connect, not-for-profit law, to develop a conflict management toolkit, which is published and available on our website. And the toolkit expands on existing resources to reflect current best practice, and importantly, it's bespoke. So it's got real examples in there of scenarios from the wildlife rehabilitation sector. Conflict management is one skill we're trying to improve in the sector, and the toolkit is a useful resource for groups to use to prevent, understand, and manage conflict before it can significantly impact a group. The toolkit also includes a sexual harassment and discrimination policy, a conflict of interest policy, a complaint form, and a committee and volunteer code of conduct. Wildlife rehabilitators are first responders to native animal emergencies, and the health and safety of volunteers is a priority. So through the strategy, we were able to award funding to the Foundation of National Parks and Wildlife to pilot a 3-year Wildlife Heroes program to help promote, support, and develop wildlife rehabilitators to continue their work. Some of you might have heard of the Wildlife Heroes Caring for Carer podcast series. So the Caring for Carers project includes a set of online resources, including the podcast, which discusses mental health, well-being of wildlife volunteers, how to deal with stressful events, as well as delving into the fantastic contribution that these volunteers make to the conservation of our native species. The website, the Caring for Carers project website, also directs volunteers to crucial helplines and links them to a suite of resources that enables them to work through challenges at their own pace. Funding has also been allocated to volunteers for vaccination against important diseases, zoonotic diseases such as Q fever and Lassa virus, and for the provision of personal protective equipment. We've also been able to support volunteers with funding, and to date, we've dispersed more than 500,000 in direct funding through the koala strategy to upgrade koala enclosures and facilities, provide rescue equipment, and provide veterinary medical equipment. We've also offered an additional 500,000 for bushfire relief for wildlife rehabilitators, 100,000 in small grants, and more than 50,000 to flood-affected wildlife rehabilitation organisations. A large focus over the past 3 years, a large focus of our work has been improving the standards of care and standards of training in the sector. We want to ensure volunteers are skilled and capable of meeting minimal standards and that they have access to the tools that they require to adhere to these standards going forward. Anne spoke about resources and how important they are. Take resources to your vet, have those resources available. Well, we've got resources. We've published more than 50 resources, which includes new and revised codes of practice. So you can see our possum and glider code of practice there. And these are really the keystone in setting standards for wildlife rehabilitation in New South Wales. They ensure high quality and importantly, consistent standards across the sector. Alongside the codes of practice, we've got training standards. And these basically introduce minimum standards of training as a requirement for volunteers in New South Wales. So some of you may know that we don't have an accreditation system for trainers in New South Wales, and most groups take it upon themselves to organise their own training. So the training standards are a way to make sure that there's some standardisation in the sector about how volunteers are trained, and will give greater certainty about the quality of care afforded to native wildlife. The initial treatment and care guidelines are another resource. Again, for each code of practice, we've got training standards and these initial treatment and care guidelines, and they're a resource to supplement the codes. So they provide a little bit more detail for that crucial 24 to 48 hours following rescue on what to do with those animals. And it's just another way for us to reinforce those codes and ensure there's minimum standards in the sector. And lastly, the compliance tool. So this is the last set of resources that sit in that package. And we've developed these to assist the sector in assessing their level of compliance with the codes of practice. So ongoing monitoring of volunteers' adherence to standards can often be challenging for coordinators and leadership teams. And this tool has been designed specifically for use by the rehabilitators. So a species coordinator, for example, could use the tool to assess if a volunteer caring for macropods, for example, has the appropriate training to do so, that their facilities and equipment are up to standard, and that they have training that's in line with what's required in the code of practice. I must mention that many of these resources were only, development of these resources were only possible thanks to the passion and commitment of both rehabilitators and vets, as they invested quite a bit of time attending workshops and meetings to brainstorm and workshop developing some of these resources. And I also wanted to note that although these were all developed for the rehab sector, we found many rehabilitators actually sharing these with their vets, because again, having both vets and rehabilitators work off the same platform, the same standards, only helps to reduce conflict when working together with wildlife. So providing volunteers with access to professional networks and knowledge is key to maintaining currency in their practices. So we've initiated a wildlife webinar series, partly also because of COVID, where everything was online. So bringing together vets, ecologists and rehabilitators to share information on webinars, understanding species ecology and how it links back to rehab practices, or getting updates on best practice management of wildlife disease will help expand knowledge in the sector and provide a wider perspective and context. I think there's a few people here that have actually presented on some of the webinars that we've delivered. We've run 14 to date over the last couple of years and had more than 1,700 participants. And encouragingly, a lot of these participants have been from the veterinary industry, which is again great to see that we're bringing everyone together on this journey to improve standards in wildlife care. We've also added some video content to supplement the technical resources. We've recently published a whole set of practical demonstration videos in collaboration with Versatile Vet. These videos are short demonstrations of key practical rehabilitation techniques. So the picture there is of our koala one, and we had Shane Flanagan, our in-house expert, speak to some of these videos. And they range on topics such as, how do you estimate tooth wear? How do you estimate age in a koala based on tooth wear? How do you handle a koala? Restraint techniques, body condition scoring. So, there was someone talking, I think Meg mentioned, how do you take a possum out of a box for a vet? So again, these resources are intended primarily for the rehab sector to again reinforce our codes, but we're hoping that we'll get more exposure and again bring vets and veterinary professionals along on that journey too. We've also offered some face-to-face training, and again, the value of face-to-face training has really been reinforced post-COVID. So we've offered funding to groups to access specialised training like bird of prey training, venomous snake handling, and also run some training of our own. So the picture here is Peter Mobbs. He's delivering a eucalyptus identification course. We've run 3 of those to date, and they've been excellent. I'm not sure how many koala rehabilitators there are in the room here, but yay, good on you guys. For koala rehabilitators, it's very important for them to be able to identify specific food tree species, and for possums as well, I guess. So this training was really valuable to provide some of those specialized skill sets and training opportunities such as these can sometimes be hard to access otherwise. So the strategy also recognises the need for veterinary professional development training, and we've talked a lot about vets recently today. Which is great. But I wanted to share some of the outcomes of some of the review of services we did of veterinary professionals, as we recognise they are important stakeholders in the wildlife rehabilitation process. So as part of that review, we put the survey out, and we had 151 vets and vet nurses respond, representing 68 practices in New South Wales. 49% were vets, 44% of respondents were vet nurses. And the survey respondents reported that they get about an annual caseload of just under 300 animals, so that's approximately 5 cases a week. Majority of the cases were brought to them by members of the public, and birds were the highest caseload, unsurprisingly, followed by mammals and reptiles. And there's a really great study by Oran Tribe where they talk about the causes of animals coming into care. And again, unsurprisingly, majority of wildlife is brought to vets because of trauma, motor vehicle trauma being the most predominant cause. In regards to the services vets provided for wildlife, 95% of the respondents said they provide some services at least pro bono. So 90% of the clinics provided euthanasia pro bono, 86% provided free assessment, and 33% had free treatment, charging only for the cost of materials. So when taking this into account and asking vets, what did they think their value of, how they value how much financial input they put in, we estimated that the annual value of pro bono services from veterinary practices to be over $1 million in New South Wales. And these are private practices that are small businesses. So the main challenges for vets relating to supporting the wildlife rehab sector were lack of time, knowledge and resources, and the cost of services. Negative interactions with volunteers accounted for a quarter of the responses, and veterinary professionals recognise the need for improved communication and conflict management in the rehab sector. On the flip side, for wildlife rehabilitation volunteers, some of the challenges in working with veterinary professionals were the availability of veterinary professionals, their varying knowledge and interest in treating native wildlife, and the increasing and inconsistent fees. So members of the public and wildlife rehabilitators rely on the services of veterinary professionals to provide appropriate treatment and care for wildlife. Majority of the vets and vet nurses surveys reported they did not consider their formal training provided them with useful skills in wildlife triage and treatment. So a lot of this, we've been discussing throughout the day, I think, and the survey really resonates with that. So this was identified as a priority area for us to provide some continued professional development. So through the koala strategy, the government allocated more than 1.5 million in funding over 3 years to Taronga Zoo in partnership with the University of Sydney to develop and implement a wildlife care professional development training for vets and vet nurses. The objective of the training is to improve the knowledge and skills of vets and of veterinary staff relating to wildlife triage, first aid, treatment and care. And the course includes 5 modules, covers majority of the taxa, and offers both online and face-to-face training components. I'm not sure you can read a lot of that in that table there, but essentially the course participants were surveyed pre and post treatment, and majority of them felt much more confident after the training in identifying wildlife, handling wildlife, first aid and euthanasia of wildlife. To date, we've had more than 14,000 vets and vet nurses in New South Wales that have completed the course. Australia-wide that have completed the course, and this number continues to increase. The program's got federal funding and is now rolled out across Australia. So you can see that although New South Wales is got the highest number of participants, we're noticing participation increasing across all the different states. But there's clearly more work to be done in upskilling and increasing veterinary capacity in treating wildlife. And I don't want to talk too much about it because, again, we've had many discussions about this, but just to say that we're aware of that and we're building partnerships with the ABA. We are working with the Veterinary Surgeons Board in New South Wales to try and fill some of those gaps and some of those grey areas, not only in the interactions between rehabilitators and vets, but also in legislation, because there are quite a few grey areas in that space. So wildlife rehabilitation data has value and can contribute to government's natural resource management objectives and promote community awareness of the sector. Each year, volunteers spend a considerable amount of time and effort collecting and providing us with important data on the wildlife they rescue, the reasons they rescue wildlife, and the outcomes of those rescues. So we want to showcase their efforts and ensure that the data collected is more effectively utilised for wildlife management and conservation practices, and try to better understand the success of rehabilitation. So we work with the sector to continually improve data. They give us data each year. It goes through a pretty intensive quality control, collation and analysis process. And then it's uploaded into New South Wales BioNet, which is a repository for biodiversity data. To date, we've had more than 500,000 records just from the rehab sector uploaded into BioNet. The data will soon also be available on SEED portal, which is a publicly available central resource for environmental data. And we recently released the New South Wales Wildlife Rehabilitation Dashboard, which you can see behind me there. That's a snapshot of it. It's a data visualization tool. It's, like I said, publicly available, and it's interactive. So you can get on there, you can look back at 6 years, soon to be 7 years of wildlife rehab data. You can look at your LGA, how many cat attacks have been there, how many koalas have been rescued. On so many levels, there's an ability now for the public to interact with this data. Another way we showcase the rehab sector's efforts is through our annual reports. We recently released one and we've got 5 to date, and I'd encourage you all to have a look. It shows some really nice trends in wildlife rescue over the last 5 years. And importantly, it's got some really nice stories, feature stories submitted by wildlife rehabilitators. And it really showcases, again, the great work that they do, both in community initiatives and the work that they do to rescue and rehabilitate wildlife. On request, we also share the data with local government, various academic institutions, and we've had, I think, about 5 peer-reviewed papers utilising our data. We also share the data with conservation management groups. One really great example is the Keeping Cats Safe at Home program that the RSPCA runs. So each year we provide them with data on cat attacks on wildlife in New South Wales, and they use that data looking at LGA levels to see how effective their program has been, the Keeping Cats Safe at Home program. So to better understand the success of rehabilitation and inform improvements to rehabilitation practices, the government has funded through the koala strategy quite a few post-release monitoring projects. There's 3 projects that have been successfully completed, one looking back at 30 years of koala data and 2 prospective studies looking at following koalas post-release and tracking their movement and survival. And these studies have provided practical recommendations relevant to pre-release assessment of koalas to ultimately improve their survival post-release. These recommendations have also been incorporated into the new Koala Code of Practice, which was also recently released. And we're continuing to provide funding and support to promote research in this space. We've got a current project funded through the University in Sydney and Koala Health Hub, again looking at prognostic indicators for koalas while they're in care that influence survival post-release. So the value of post-release monitoring, specifically in informing rehabilitation practices, is significant. So it's great that we can continue to support these projects. I don't have much time to talk about a few of these others, but I did want to say it's not always koalas. There's other species that we also work on in New South Wales, although it might not seem that way. We are working with academic institutions to support post-release monitoring in other species, brush-tailed possums, for example. And we've recently introduced the Curb Wombat Mange program, which offers more than $2.5 million in funding, both to equip volunteers on the ground to help combat mange and wombats, and also to promote research to better understand how to treat mange more effectively. So I'm happy to chat to anyone about this if they're interested over the coming days. Last but not least, the the work we've done in supporting and regulating the sector, which has actually been a huge piece of work that's ongoing in the background. The department is a partner in delivering rescue and rehabilitation services in New South Wales, and a key objective of the strategy is to ensure that the services provided by rehabilitators are consistent, that they're reliable, and that they're in accordance with standards. So we're moving towards a more effective model of regulating and supporting the sector, and we recently released a rehabilitation of protected animals policy in 2022. So the policy outlines who we license, how we license them, and why we license them. And it retains the current model, but allows for more flexibility. For example, for facilities, for organisations providing specialist care for certain species, and for animal display establishments such as zoos. The policy also encourages younger people into the sector. If you remember, I mentioned earlier that a very small proportion of people are under 30 that participate in wildlife rehabilitation in New South Wales. So the policy tries to remedy that by, again, encouraging younger people into the sector by lowering the age of participation with appropriate supervision, of course. We also wanted to cut some red tape with this policy. So there's been some changes around import-export licensing. We've allowed for longer license terms and also allowed for other community activities under the license, such as the in-situ treatment of mange in wombats. The most notable addition to the policy and regulatory framework is the introduction of quality assurance. So all rehabilitators in New South Wales are required to undertake a quality assurance process to receive a biodiversity conservation licence. Quality assurance is administered by the department and will review the governance of groups, the training and support they offer, their standards of animal care, their service capacity, their record keeping, and also, interestingly, their engagement with veterinary services. Rehabilitation providers will be required to have policies and procedures in place to ensure interactions with vet practitioners are consistent, positive, and ethical. So it's been a pretty big undertaking. We've just completed quality assurance across the sector for currently licensed groups. And I just wanted to say, for anyone listening from New South Wales crowd, thank you to all the groups for coming along with us in that process. So before I finish, I wanted to share some of the work from the Bushfire Emergency Response for Wildlife team. Thanks to John, Tash and Saskia for these slides, and really kudos for them for all the work that they've done. Emerging from the 1920 Black Spring and Summer bushfires, national parks have made significant improvements to how the New South Wales government responds to wildlife emergency events. The work of the bushfire team focuses on capacity building for New South Wales firefighters in response to injured wildlife, as well as upskilling vets and wildlife rehabilitators in incident response. It responds to recommendation 53 and 76 of the New South Wales Bushfire Inquiry and an action 3.8 in the koala strategy, which is to improve emergency response for koalas and other wildlife. They've done some really key work in upskilling New South Wales firefighters through the Wildlife First Response Training for New South Wales Firefighters. It's an online course, and it was developed in partnership with National Parks, the Environment Trust and the Taronga Conservation Trust. The online course provides an introduction to firefighters responding to injured wildlife and includes a wildlife response decision matrix, a catching and restraint techniques, and equipment lists. The course has been taken up well by hundreds of rangers and field staff, and more than 2,000 copies of the handbook are being distributed across New South Wales firefighting appliances. National Parks is also investigating a practical wildlife handling course to accompany the online course. The team have also been drafting a wildlife emergency response guidelines, which provide a planning framework and standard operating procedures for the safe and humane response to injured wildlife during an incident. The draft manual, which you can see on the left there, is currently being reviewed internally. And there's 3 new wildlife-focused incident role summaries in the guidelines. So we've got the Technical Advisor Wildlife, we've got the Wildlife Emergency Response Team, or WERT, and the Wildlife Emergency Response Team members. The little table you can see there highlights where these roles will sit and their reporting lines in the incident management team. These roles and guidelines were trialled recently during a one-day workshop in June, and the workshop involved both incident and firefighting staff, as well as veterinarians and wildlife rehabilitators from the working group, and National Parks is investigating running future workshops. National Parks has worked with stakeholders from the veterinary and wildlife rehabilitation sector through a Wildlife Emergency Response Team working group, the WERT working group, and a number of them are shown here. Capacity building of this group aims to allow personnel to operate as WERT members and leaders, and National Parks has worked with Wildlife Heroes to provide this WERT working group with training in bushfire awareness and in Australasian Inter-Service Incident Management System, AIMS training. Geez, there's a lot of acronyms. National Parks has also provided Schedule 1 fireground PPE for a number of groups that meet specific criteria. So that's a little blurb about the bushfire team. If you've got any questions about that, I will direct you back to them, but I'm sure I can pass them on. So it brings me to the end with 5 minutes to go, not too bad. But before I finish off, I just wanted to share some of the challenges we've been discussing in our team for the rehab sector and wildlife rehabilitation moving forward. And just to say there's still a lot more work to be done. We're constantly talking about how wildlife rescue numbers are steadily increasing as are the threats to wildlife. This is in face of an increased demand for veterinary services and a shortage of veterinary professionals. So veterinary services are already stretched and under-resourced. And as many of you know, there's actually an inquiry in New South Wales at the moment looking into the veterinary shortage. We have an ageing sector with socio-economic changes that are likely to impact long-term service delivery. So as I said, most of our groups at the moment are home-based wildlife rehabilitators, and things might need to change in the future to make that sustainable. And states have their own laws, and wildlife rehabilitation is not always considered a priority in all jurisdictions. So moving forward, we really need stronger national engagement to bring all parties together to influence and support the wildlife rehabilitation sector to continue to deliver its services, which are clearly vital for native wildlife. That's me. Thank you.
Okay, we've got probably 3 minutes for questions. Did anyone have any questions they'd like to ask? Oh, we've got a few. Alrighty. We might just pass these ones around if that's easier.
This might be a tricky one.
Thanks, Simone, of course. First question. Yeah.
I got you, Aditi.
Yeah.
Stronger national engagement. How do you reckon that looks?
Yeah, look, I think what we discuss in our team is always the different priorities across the different jurisdictions. So I know in New South Wales, we've been lucky to have funding to resource a team to work on the rehab sector strategy. I know Tasmania's got their own strategy at the moment, but in the few occasions where we've had cross-jurisdictional engagement, it's been clear that priorities are different, licensing systems are different across the states. So I think in the first instance, it would look at like just getting together more often and ensuring our goals are aligned. It's hard to work across, different laws in different states, different licensing requirements. But I think having those conversations about some really clear overarching goals and outcomes and where we see the sector in 10, 20 years is sort of an important start.
Has DQ been involved in any of those discussions?
I will cop out of that one by saying I've only been in my role for a few years, so I think
that's the Federal Department of Environment. Because it's a really fraught space.
Yeah, look, post bushfires, they definitely. I know they facilitated some meetings, but people much higher up than me attended those, and I know there was more momentum at that time post bushfires. At the moment, outside of koalas, not really, not in the Eastern Seaboard anyway.
No worries. I'll run this down to you.
Should be an easier question, I think. Thank you very much for your involvement in the Wildlife Hospital and the training. There's a lot about the training. I really, really love that training. It's been great for us to have it. Secondly, you mentioned about some seminars that you had online. Mm-hmm. Can other states have access? Yeah. That's a really thing for our vets to take away. But we can send it that way to have the fact away with aging as well, that kind of stuff. Yep, it's all publicly available. So it's on our website, but it's also on Versatile Vet. So I'd encourage everyone here to go on Versatile Vet website. Sally Miller, who runs Versatile Vet, has done has been great working with us. And all the wildlife videos on there are free, so anyone can access them. So the koalas were the first ones we did, as always. We've also got a really great series by Dr. Duan March on sea turtles and sea snakes, which is excellent. So some really key skills around body conditioning, collecting blood in a sea turtle. I don't know how many vets have tried to do that in this room, but they always say it's easy, but it isn't. So great video on that. And we've also got one on the in situ treatment of mange and wombats. So Dr. Scott Carver presented on that, which is great. Yeah, all our webinars are also recorded and online. So if you go to the Wildlife Heroes webpage, there's a section there which has all our webinars. So there's some great ones. Peggy Rismiller did an amazing one on echidnas. We've had ones on wombats. Michelle Power, who's here today, did a great presentation on antimicrobial resistance. So yeah, quite a few resources that again work for both vets, veterinary professionals, rehabilitators, ecologists, a whole mix of people that we should all be bringing together.
Great, no worries. We are out of time, unfortunately. So yeah, one more big round of applause, everybody. Yeah, sustainable gifts. Thank you.